Assalamu alaikum, everyone, and Juma Mubarak on this kind of cloudy Friday afternoon. Inshallah, I hope you all are well. Today, our khatib is going to be Ashik Fazlullah, and he's going to be discussing growing to Allah subhanahu wa ta'ala's Qadr. And Dr. Asma Ali will be our community learning and dialogue presenter. She's going to be discussing women's health and preventative care. After Ashik gives the khutbah, they will pause live for Salah. While they're doing that, I'll give you some announcements. I'll give you a little background on Dr. Ali. And then inshallah, once they are finished Salah, we will begin our community learning and dialogue program. So Ashik, inshallah, if you could begin.
Assalamu alaikum, everyone. Juma Mubarak. Alhamdulillah, alhamdulillah. Praise be to Allah, praise be to Allah. Ashhadu anna la ilaha illallah wa ashhadu anna Muhammadar Rasulullah. I bear witness there is no deity of worship other than Allah, and I testify that Muhammad is the messenger of Allah. O you who believe, be mindful of Allah as His is due. Make sure to devote yourselves to Him to your final moments. Praise be to Allah who blessed us with guidance of His prophets and messengers. Praise be to Allah whose mercy encompasses everything. Praise be to Allah who knows our needs, answers our calls, and brings peace to our hearts. So Assalamu alaikum, everyone. Juma Mubarak. Today's talk is about Qadr, trying to grow, to learn, to accept Qadr, Allah's divine decree. So this is a shortened version. For a more elaborate version, you can read Purification of the Heart. This is the chapter on accepting divine decree. So sometimes I think we can catch ourselves saying, I don't deserve this, or why is this happening to me? And it can be hard for us to maybe fully accept or understand Allah's plan. And while we can't choose what's going to happen to us, I think we can choose how we respond to it. What intention do we take to the situation that Allah has put us into for a good and beautiful wisdom? So people of taqwa, God-conscious people, when asked, will say their Lord has given them everything that is good. And they say this out of a knowledge of the nature of the world, that this is a temporary place, this is a place of trial and of purification. And because of this elevated state of their spiritual heart, they're really patient with difficulties, trials, afflictions, things like that. So the scholars have said that there are four basic states of being. And we are all in one of them, or maybe a couple of them at any given time. A person is either a receiving of blessings, they are enduring difficulty, tribulation, things like that. They are living in obedience of Allah, or they are living in disobedience of Allah. And then they say each of these responses, each of these four states has a response. So when we are in blessing, when Allah has given person blessings, the response is gratitude, shukr, in all of the ways that we can. Gratitude is an active way of appreciating in our heart and acknowledging that we have received something that we have not earned. It was a gift, it was given. So the second thing that we could be enduring is tribulation, difficulty. So the response of tribulation, we may probably know, is patience, sabr. And sabr, I think, at least in modern English, the translation of patience is not really great. It's only partial. Maybe perseverance is a little bit better. It shows that there's something that we are asked to do. We don't just sit there and sort of take it. We accept that this is difficulty, and then we try to work our way through it, knowing that there's wisdom in this difficulty. So this is an expectation of people that there will be times of difficulty. And a beautiful sabr, as close to as possible as the prophets, one of them is Prophet Yaqub. He exhibited the response of the disappearance of his son Yusuf. So he had sadness, he cried, but he does not forsake Allah. He does not call out negatively to Allah. He bears the pain, but knows that there's wisdom in the pain from Allah. The third way is obedience. So as for obedience, we recognize that even the gift of obedience is from Allah. If a religious person starts to believe that they are better than other people, even if these other people are doing things that they shouldn't, it's a danger in itself. The danger of obedience is that we may become self-righteous. Imam Ibn Atta'illah, he has a quote, "How many a wrong action, so disobedient actions that lead to a sense of tawbah and impoverishment before God is better than obedience that leads to a sense of pride or arrogance." So yes, the actions matter, but again, the state of the heart is what we're after. If you can, through obedience, remain humble, that's beautiful. If through obedience we start becoming a little bit arrogant, that's something we need to be careful and look at ourselves. Interestingly, since we share space with the church, in the New Testament, so this is the primary text for Christians, there's a story of the pride of the religious Pharisees and the sorrow, contrition, and tawbah, really, of the humble tax collector. This is in Matthew 23:12. And the quote is, "Those who make themselves great will be humbled, and those who humble themselves will be made great." And so we see this in the Islamic tradition, that there's so much patience, beauty, humbleness, pure taqwa in people who have very little and are enduring a great deal of physical, emotional difficulty. And sometimes those of us who have a lot of material things have trouble remaining steadfast. It's an interesting phenomenon. So the last piece that we'll talk in this first part of the khutbah is disobedience. When it comes to disobedience, if we find ourselves in disobedience of Allah's commands, the response is repentance, tawbah, seeking His forgiveness, seeking His pardon, seeking His mercy, feeling remorse for what we've done, and then making the best of niyas, the best of intentions to not do that act again and not sink into that disobedience again. So the scholars say that everything that happens to a person falls into one of these four categories, and each of these invites one of these four responses that we are able to do. So what comes to a person in his or her life may help a person move closer to Allah if the response is right. So even when the act is negative, if the response is in the positive way, you can sort of move toward Allah. Sometimes people will ask, when they're going through a difficult time, is this a trial or is this a punishment from Allah? And many of the scholars will say that if you see yourself during the period of difficulty growing closer to Allah, it was a trial. And if you see yourself giving up on Allah's mercy, then maybe it was a punishment. That's a way to understand it. Only Allah truly knows. So we'll close the first part of the khutbah with this ayah from Surah Baqarah. This is ayah 216. It may be that you dislike something, though it is good for you, and it may be that you love something, though it is bad for you. Only Allah knows, and you do not know. Allahumma salli ala Muhammadin wa ala ali Muhammad kama sallaita ala Ibrahim wa ala ali Ibrahim. So Ibn Abbas said that if a person is tested with difficulty, with tribulation, they will find it in three blessings. So there is difficulty, but this is sort of the silver lining of the challenge. First, the difficulty could have been worse. Anything that we're going through, you can always imagine it being more painful, more enduring, more traumatic. Secondly, that it is in worldly matters, meaning material, meaning a job, food, a relationship, and not in spiritual matters, that Allah has not shaken the core of your belief. It's only something material and around us. And the third challenge blessing in this challenge is that it came in this world, in this material world, in the dunya, and not in the time in the grave, not in the time on the judgment day. And in this time when there's always additional time to reconcile and grow closer to Allah and change our ways. Imam al-Qarafi distinguishes in his book Al-Faruq the difference between divine decree and being content with the divine decree. So sometimes, and particularly nowadays, we see a lot of oppression. People might say, should we be happy that things are happening as they are, these bad things are happening? Now, this is all part of Allah's decree, part of His plan, but for the people enduring difficulty, it's a test to remain patient. But for those of us who are witnessing difficulty, who are witnessing oppression, but not fully feeling it, it's a different test for us. It's a test to respond in the way that we can. So when one sees societies plunged into immorality, or we see something not to be pleased with, we be careful not to be indifferent to it. On the contrary, Allah would want us to dislike it. We should never resent the plan or be displeased with Allah Himself, but we can sort of understand how to respond to injustices, to difficulties, whether it's with our voice, with our material assets, or with our limbs. So Al-Qarafi gives an example, kind of a simple example. So he gives the example of a physician who amputates the arm of somebody who has gangrene. Spreading out of control, the doctor decides to cut is better than to lose the patient. Later, some time passes, this patient recovers, but the physician, the doctor overhears the patient complaining that the physician was stupid, ignorant, cutting off his arm. And the physician is sort of offended. He saved this person's life. Now, had the physician heard this patient praising him, despite the fact that there is difficulty in losing the arm, the doctor may have felt a little bit more compassion for him. And so although Allah is not affected by whether we praise Him or not, we are only affected or we lose out. It's better to say God is testing me and His will and wisdom there is in it. So that differs definitely from perceiving that there's something wrong with the plan. It's saying that there's difficulty with the plan. I need patience. I need help from Allah to accept it. So I'll start to wind down with sort of a more recent example. Many of you may have heard Imam Suhaib Sultan, who passed away about 40 days ago. Just the other day was the 40th day of his passing. In his blog posts in the last year of his life, while he was dealing with his cancer, he wrote this one post. I'll take an excerpt from it. And to me, it really amplifies how to be able to accept Allah's decree in 21st century, in modern world. Because sometimes we think, oh, this is how people used to be able to do it. How can I do it today? So this is an excerpt. It says, recently, a beloved relative of mine was having a hard time seeing me in such physical pain. This is pain from the cancer. And in a moment of desperation, started to curse the cancer. In that moment, as much as my heart empathized with their heartfelt intention, something just didn't feel right. Upon further reflection, I realized the cancer had become somewhat of an intimate companion over the last few months. Yes, at times annoying, pestering, painful companion, but a companion nonetheless. It's like a younger sibling who you might really be critical of and even lose your temper with, but feel very protective toward when somebody else is critical of them. Cancer has even become one of my most important teachers in this life. So, I mean, here is somebody in the 21st century in America, in New Jersey, our lives, right? These are not distant lives away from the challenges and difficulties and influences that we face. Here's somebody who's going through something that is very final, very physically painful, very emotionally distressing, but he has come to accept decree to the point where he is a little bit upset with when somebody else is unable to accept the decree. You know, sometimes there's a phrase in contemporary American society when somebody passes away, if they're young especially, oh, they died before their time. I think for Muslims, if we're aware of our theology, this phrase has it doesn't quite sit right, because nobody can go before Allah took them, right? Their time is their time. This phrase that they went before their time doesn't quite make sense in the Islamic context. Allah is aware of everything. Allah's plan is good. So before their time, what we're really saying is before the time that I would want this person to go. But in reality, they were taken back at the exact moment that was planned, that was meant to be. So we'll close with another ayah in Surah Tawbah. This is chapter 9, ayah 128. Messenger has come to you from among yourselves. Your suffering distresses him. He is deeply concerned for you and full of kindness and mercy towards the believers. Ya Allah, keep us in your care and protect us. Ya Allah, you are the forgiver, you love to forgive. Please forgive us. Ya Allah, forgive the shortcomings of all those who have passed away. Multiply their many good deeds, give them ease in the grave, make their graves wide and bright, open a window to Jannah for them, give them patience, give those who remain behind patience and strength to bear the loss. Ya Allah, reconcile our hearts with one another. Waqim as-salah.
Ameen. Thank you, Ashik. Jazakallah khair for such a beautiful khutbah, mashallah. The live in-person participants make salah. We can pause ourselves for salah and then come back for the community learning and dialogue program. So please give it 5 minutes for them to make salah, and then inshallah, we will join them.
Mute? I didn't.
You don't mute yourself. We want to hear you. Thank you. So inshallah, they'll pause for salah. You can make your salah now, and then 5 minutes, we will have the community learning and dialogue portion.
إنا أنزلناه في ليلة القدر وما أدراك ما ليلة القدر ليلة القدر خير من ألف شهر تنزل الملائكة والروح فيها بإذن ربهم من كل أمر سلام هي حتى مطلع الفجر. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله الله أكبر. بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم Allah. Samiallah, Allah. 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 Assalamualaikum warahmatullah. Assalamualaikum.
Jazakallah khair, mashallah. So mashallah, while everyone is making their dua and their sunnah, I will read a few announcements as we wait for our CLD speaker to join us. Today's announcements are, we had a wonderful, successful barbecue this past Saturday. The Mainline Muslim Society community enjoyed its first successful outdoor Eid barbecue. The chicken, the burgers, the salad, the fruit, all the goodies, everything was excellent. Thank you so much to the board of directors and all the volunteers who made the day a total success. Ice cream truck was a huge hit, mashallah. About approximately 80 people attended and everyone had a great time. It was a wonderful sense of community. People came throughout the day. So it was really wonderful. And we're really looking forward to the next community event like this. So that everyone knows, Aisha prayer is being held daily. The doors to the prayer hall open 10 minutes before the Adhan. So please join us as often as you can. Family Fun Night and Potluck, the date has changed. The date for this new event is June 12th. Please mark your calendars accordingly. We are hoping to celebrate all of our graduates on that day. So come and join the MLMS community for an evening of good fun. Bring what you can, it is potluck, and have a great time. It'll be from 6 to 8 p.m. and then we'll pray Maghrib, inshallah. We're looking for volunteers. If you'd like to get involved, please visit our website or the link through our newsletter. We are always looking for volunteers to join us and help us be able to offer more programming and do more things. So inshallah, please volunteer your time and treasures if you can, inshallah. Our speaker is having some technical issues, so just give us a moment and she will be joining us shortly. But in the meantime, does anyone have anything they'd like to share? Any comments or questions from our khutbah? I loved hearing the second imam we had participate during Salah. That's always a joy for me when I hear the children participating in Salah like that. So I love that, mashallah. So in the meantime, while she's trying to get back in, let me read a little bit about her bio and talk about her. So Dr. Esma Ali, she currently, Samina, confirm for me, where does she live right now?
Houston, Texas.
Houston, Texas, mashallah.
Yeah.
So she's in Houston, Texas, mashallah. and she is going to be speaking on women's health and preventative care. In 2006, Dr. Esma Ali earned her medical degree from Temple University here in Philadelphia, and went on to complete her obstetrics and gynecology residency at Lankenau Hospital in Wynwood. So Dr. Ali is a member of the American College of Obstetrics and Gynecologists, the American Association of Gynecological Laparoscopists, never going to say that right, and the American Medical Association. In her spare time, Dr. Ali enjoys traveling and spending time with her husband and 3 small children, and has a beautiful cousin here in our area, Sister Samina. If there's any sisters who would like to present during our community learning and dialogue segment, please reach out to us. We're always looking to hear new voices and new topics. You can reach out directly to Sister Tahia at tvikalo@gmail.com. We would love to have you, and we'd love to give you the opportunity to speak to our community. Sister Samina, how are we doing? Any ideas? Any clue how she's doing with her technical issues?
Yeah, she said it keeps saying that logging in or connecting, but it doesn't connect.
Yeah, that's a bit tricky. Okay, we'll give it a few more minutes, inshallah, and then if not, perhaps we can reschedule, inshallah,
Inshallah.
for
Okay.
another week. But let's give it a few more minutes, inshallah, and see how we do. Sister Hiba, I'm glad to see you back, even if it's only listening in.
I'll just mute for a second. Yeah.
Okay, while everyone is making their sunnahs, please make dua for our community. I'd like to make some dua. Samina, perhaps it's best, I don't want to rush her in her presentation.
Yeah.
I'm not sure how long it was.
Yeah.
But perhaps, unfortunately, because of the technical issues, we'll schedule this portion of the
Sure.
in the meantime, I'd like to make dua for the community. May Allah subhanahu wa ta'ala bless each of us to be healthy between this Juma and the next. Oh, alhamdulillah, she's with us. Let's see if she's able to connect. Assalamu alaikum, Sister Esma. Can you hear me okay? You're on mute.
Yes, I can hear you pretty well.
Alhamdulillah. Alhamdulillah. How, Sister Esma, I don't want to rush your presentation. I know you had some technical issues. How long is your presentation for us today?
10-15 minutes.
Okay, great. Then let's go ahead with that. That's fantastic. I didn't want to compact your presentation, so we were contemplating rescheduling, but that's great. I'm glad you were able to join us, mashallah. So I'm going to turn it over right to you.
Okay, yes. Assalamu alaikum. Sorry, I was having some login issues. I think what worked was me turning my phone off and restarting it. Somehow that worked. But anyways, so sorry about the delay. I was planning to have like a PowerPoint and all that, but I'm just going to do straight talking. So my thought was to just sort of do the women's health and talk about, what to kind of expect, especially when you go to the doctor. And what's sort of important. So I'm going to break it down by age group because I think that kind of helps, what's needed, what kind of screening tests are needed. So usually we see sometimes girls less than 21 years of age. So we kind of have that category because a lot of moms ask me, when should I have my daughter come to an OBGYN? So that's a common question we get. And if, rest of the population, if they're sexually active, then we do see them before 21 years of age. If they're not, then we actually start at 21 because that's when the screening starts for cervical cancer. So pap smears, we start at age 21. which is kind of different than what we used to do in the past, because some of the moms that bring their daughters, they're kind of upset, like, oh, I had to come when I was 16 years old, but no, not anymore. If they're having any kind of period issues or things like that, we will see them, not necessarily examine them, but at least, see them, see if there's anything that needs to be done as far as testing, things like that. So we do see younger girls before that if they're having issues. If there are no issues, then we start at 21. Then the category, we call it premenopausal. So 21 till menopause is one category we use. And even the guidelines for cervical cancer have kind of changed. Used to be every year, everybody, but now if you're less than 30, they're in low risk. The screening is actually every 3 years for pap smears. And after 30, women can go between 3 to 5 years. Our office, we're still doing 3 years. We're still getting used to spacing those pap smears out. So that our office, we're still doing 3 years screening. And the reason why that 3 year, 5 years has new rules have changed, because when we do the pap smear, we actually do human papillomavirus testing as well. So both of those combined, if they're negative, the chance of somebody having cervical cancer is very low. So that's the reason why we kind of space it out that way. So that's usually the kind of examination and stuff, the breast exam, everything that goes along with it. And we start mammograms at age 40. Actually, the OBGYN ACOG is what we use as our tool for guidelines. And they recommend after the age of 40 to have mammograms every year. So it's a lot of, screening, but the incidence of breast cancer in the population is 1 in 8. So if you are having a gathering, even among yourselves with the women, and you're in a group of 8 women, one of you is going to get breast cancer at some point in her life. So it's pretty high. So that's why we start at 40 and we check every year. And mammograms we love, because even before a patient can feel a lump, or a doctor can feel a lump, the mammogram picks up little cells, so very early detection. And it's amazing that they can pick that up so early. But sometimes the treatment too, once people are treated, they can go on to have normal life and everything. So that's why we love mammograms so much, and and we kind of push that on people. So that starts at age 40. And then when does that transition happen between premenopause and menopause? Because that's a big step in a woman's life. 51, 52 is the average age of menopause. And when I say menopause, what I mean is 12 months of no period, then you're categorized as menopausal. So that's a big transition too. Some people it happens earlier, some people happens a little bit later. So a lot of our patients that come to our office are because of those kind of symptoms as well. So we kind of help them through that transition. And actually 50 is another big milestone, because after that we recommend colonoscopy. So colon cancer is also a big problem, and the incidence is pretty high in the population. So colonoscopy is a great tool, because not only do they diagnose if there's a colon cancer, but they actually do treatment, because some of the polyps that they're precancerous, they actually remove them out of you. So that's something that started at age 50. And if everything's fine, they do every 10 years. If they're kind of worried, they'll have you come back at 5. If they're really worried, then 3 years. Some people get colonoscopies every 3 years. So that's another thing we talk about. And this is more of the women gynecological health. Other things on our mind when we see somebody for the yearly checkup is heart health, because one of the things that affects women is heart, is a big part of their health. So, but we're not testing for cholesterol and all those things. So we highly recommend that the lady sees a primary care doctor as well, because that's where they're doing the cholesterol check and thyroid, diabetes check, and they manage that. So we highly recommend both combined, getting a physical from primary care doctor and then OBGYN for their women's health. And a lot of the problems that people come into our office, heavy cycles is one of the very common complaints. Then we screen for fibroids, because a lot of things that we do is treatment for fibroids as well. So that's a big part of what we do daily. And besides breast cancer risk and cervical cancer, uterine cancer is also something that we do worry about. So if somebody has menopause and then they're bleeding afterwards, that's the first thing we screen, look for that. So no, if you're having any bleeding after menopause, then definitely go to the doctor. And one other thing that does, well, ovarian cancer is kind of rare, so, but that's another thing we worry about as well. And at later ages, prolapse is another problem people don't discuss. They don't feel comfortable with their doctor, but that's another issue that does come up with prolapse, with things kind of falling down. So we address that as well. And then not necessarily us with the urology, but leaking urine is another common issue that women don't feel comfortable talking. So we try to get it out of them so we can see how we can help them. So that's kind of like as far as, you know, women's health and OBGYN, like what are we kind of talking about. So that's what we do for most of the part. But I wanted to find out if anybody had specific questions or anything that we can kind of gear towards. Does anybody have any questions?
I have a question. So at what age can you stop having pap smears?
Yes, very good question. So 65 is the recommendation. Above that, you don't need pap smears. But in our office, we actually do them even for older women because they're, you know, their sexual health, they're having, you know, partners and stuff like that. So we do screen them for that. So we don't really have a hard cutoff, but if you generally overall low risk women haven't had any problems in the past, then after 65, some people stop.
Fantastic. That's great. Any sort of supplements women should be taking regularly?
Oh yeah, good question. I didn't really touch into much of the diet and as part of it because I know that's a big topic. You know, healthy diet is very, very important. Exercise goes along with it, and I'm not doing much of that. But the vitamins, yes. So after menopause, calcium and vitamin D becomes really important because studies have shown that that decreases your risk for osteoporosis. So calcium and vitamin D are important. But there's 50 women's once a day, 50 plus. That usually has a lot of that already in it. So that's a good vitamin to take. Women who are less than 50, then just a multivitamin is good as well. Some people I recommend just taking the prenatal vitamin. Sometimes it's shown to help with the hair and stuff like that. So taking a prenatal vitamin is good as well. But yes, diet is very important because the more healthy diet you have, the more good things you're putting in your body, you'll feel better too. And exercise too, it's really hard. I actually was my personal experience. I wasn't exercising, so it was hard to get into it. So I tell women just take once a week, just, you know, start with that. And then as you go by, like it takes 3-4 months for you to be kind of feeling better, feeling good with exercise, then add more to it, like 2 times a week. And keep adding 3 times a week. And I got to a point where I was going to the gym every day. So it can be done, but it takes a long time, sometimes a whole year to get to that point.
Mashallah. And you think supplements in pill form the delivery system is acceptable?
The delivery system, you mean like a oral intake?
Yes, from an absorption standpoint, I've heard things in the past that say that it's not absorbed well in the body when taken through pill form, that you should use either an isotonic version or a liquid version, chewable.
Not necessarily. As far as what we recommend, no, we just recommend the over-the-counter. Caltrate is the one that has the calcium and vitamin D. So yeah, not liquid form or anything now.
Okay, fantastic. Yeah. Does anyone else from our viewing audience have any questions? Let me see if we have anybody on our Facebook Live asking questions. I don't see any at the moment, but anyone on our Zoom have any specific questions?
I just had a question about the colonoscopy. I usually thought that it was only for men.
Oh, yes.
Yeah.
Yes, very good question. No, women as well, because colon cancer doesn't discriminate between men and female. As far as only men concerned, that would be prostate check is the only thing that they but women have colon as well, and the incidence of colon cancer is high in women as well. So yes, after 50, and actually a lot of places have female gastroenterologists. So, you know, it's always what people tell me. I never had one myself, but what people tell me is the night before is the problem, because that's when you get it cleaned out, and it's, you know, going to the bathroom so often can be annoying. But then actual procedure, they're put to sleep, so they don't feel anything. So procedure people don't have complaints about.
How do you feel about these home colonoscopy tests?
Yes, so that's another alternative as well. So you take samples of stool and send it in, and that works fine. I think the studies have shown that both are fine. Problem is you have to do it every year, so it's not something once and then nothing to worry about for 10 years. I'd rather do that. Nothing to worry about 10 years. One, but I said they actually take out precancerous polyps too, so it's great that as treatment wise.
Okay.
Yeah.
No. Okay. Fantastic. Sister Hiba is saying the prep wasn't horrible, but not pleasant either. The colonoscopy itself, she said it was the best sleep she's had since having children. So I believe that. So, mashallah. This is such a blessing having you here with us, Esma, because, as women, we don't often have an opportunity to discuss in an informal way with a doctor of your caliber issues that come up for women, and even for our brothers to hear this. It's important for them to know how to support their wives and their sisters, their mothers, their daughters. So it's important for everyone to be informed about women's health. As we know, the women are the center of the home. So inshallah, if mama not feeling good, nobody's going to feel good. So it's important that we each take care of our health and take these things seriously. Jazakallah khair for your time, and we know how busy you are, mashallah. I have to say, just as a personal note, there is clearly a resemblance, a familial resemblance. So if I didn't know y'all were related before, definitely know now, mashallah. So too cute, the two of you, mashallah. So thank you so much for joining us. Jazakallah khair. We're going to give Samina extra brownie points for bringing you in, mashallah. She'll get a little gold star by her name for the day. So thank you, really. Wallahi, jazakallah khair. We appreciate it. Inshallah, you'll come back and join us again.
Yes, absolutely.
Inshallah. Let's make dua, inshallah. So may Allah subhanahu wa ta'ala bless us and keep us. May He keep us healthy from this week until the next. May He continue to grow our community so that we can grow strong with one another and support one another. May each of us reach out to those that need help and reach out for ourselves if we need help. May we focus on our health and well-being, both spiritually, mentally, and physically. And may Allah subhanahu wa ta'ala guide each of us to be stronger in our iman on a daily, inshallah. Ameen. Jazakallah khair. Juma Mubarak, everyone. Inshallah, we'll see everyone soon. Assalamu alaikum.